Bob and Brad, the two most famous physical therapists on the internet.
Peace, folks.
Oh, wow.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together we are
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We got today 5 critical questions to ask a low back patient, which could be you, to fix your pain fast, to fix it fast.
Right. And Bob, these are 5 questions that you and I always ask every back patient, and we kind of go through them and we jot down in our notes, and that information can be very critical.
Can help you direct it.
Right.
Your treatment.
And be a very large part of the treatment program, therefore getting things to fix fast.
Speaking of back pain, by the way,
Oh.
this week we're giving away some hanging handles.
Yes.
And that can be very helpful for people who are having sciatica or regular back pain.
Right.
So go to bobandbrad.com, go to the giveaway section, and just sign up.
Right.
And you
Yeah.
can win a pair.
It's a form of decompression or traction. Very can be very handy. Bob, I did want to say one thing. I remember one of my better back courses I went to after being a therapist for a number of years. The instructor said, listen to your patient because they will tell you the answer.
They will direct you.
They will direct you to the problem, but listen and ask the right questions.
Right.
I'll never forget that, and it's very true. So these questions, ask yourself, or actually get a piece of paper down, and you may not have the answers right away, and we'll explain a little bit about that, but write the answers down, and it's going to help you treat yourself and get you better and get you going the right direction. So the first question, was there an obvious cause for your back pain? For example, did you fall? Did you twist really quick or playing a sport? Oftentimes, actually probably more times than not, people say no obvious cause. It kind of came on gradually.
And in those cases, it usually is posture, and usually with the posture is putting tension on the tissues, abnormal tension. And so we want to correct that, obviously, if that's the issue.
Right. So I think one of the big things to get is if there was no obvious cause, don't get too excited about it or think that's odd because it's very normal.
Very normal.
Yeah.
The majority.
Yeah. So question number 2. What specifically makes your pain worse? Now, I can't tell you, and Bob and I both agree with this, how many patients we've asked this. And
they'll say everything.
Yeah, everything makes it worse. And it will seem like it, but once we get into asking a few more questions and they start telling us some things about how their day-to-day life goes, they'll say, and then this makes it worse. And then it's like, oh, so something does make it worse.
Right.
And now we got a hypothetical patient here. We're going to say this person said, after getting around things, sitting in certain chairs or for a certain length of time makes the back pain worse. And
the other thing you may want to do is throughout your day, pay attention.
Yes.
Have a little notepad and write down, oh, I guess that did make it worse.
Right. Right. And, I always had patients make mental notes or actually write it down so you remember because especially you get a little older.
Our memory is faulty.
Exactly. Now, the third question is just the opposite. What specifically makes your back pain better? Very common off the cheek answer is nothing. Nothing makes it better. It always hurts. But then oftentimes if you start thinking about it, you realize maybe sitting makes it better or standing, or maybe walking hurts at first, but after 20, 30 feet, it starts to settle down and then it feels good for about.
Well, let's say your pain is like at 8 out of 10 and it goes down to 6 out of 10. That's better.
Right. Yep.
You gotta make note of that.
Exactly. So anything that consistently even drops it a few levels as opposed to making it disappear with that. I mean, sometimes that happens, but usually not particularly.
The first thing I'll say to people is they say nothing makes it better. And I go, so you're in pain 100% of the time? And usually people say no.
Yeah.
I mean, there's moments in the day where I don't have pain.
So you have to think about what are you doing at that time or just before that made it better or made it worse?
Made it worse.
And write them down.
Really important to know this.
And now in this case, and this is kind of common, it feels better, but after they walk 100 feet or so. But if they
Right.
walk up 4 or 5 blocks and it starts to hurt again.
Right.
So there's a period of walking that maybe helps this person. And this is kind of a common scenario. Does the pain, next number, does the pain or numbness or tingling symptoms, does it run down one leg or both legs, or maybe it doesn't
Not
go
at
down?
all.
Yeah.
Right.
And actually, what I always do is I have a stick figure on a piece of paper, and I'll draw. So yeah, the pain goes down this leg, but it stops about right here, and it never goes down to the foot. So I'll draw that because I can't remember that.
Right.
And
Right.
so when I see the patient the next time, I'll ask them, "Does it still go down down the leg that far?" And they'll say, it doesn't. It doesn't even go down to the
Right,
knee anymore.
right.
But they kind of forgot about it because it's gone.
That's
It's
the
just-
other thing. People have a faulty memory and knowing that they're getting better.
Yes.
And unfortunately, when they start getting better, they start doing more things, so that may send them back again.
Right. So yeah, all these little things are really
Right.
critical. And then this last was a really general question, fits into the number 4 actually. Does your back feel better in general when you're up walking or when you're sitting
Right.
for a length of time? And usually people can pick that out pretty good. If it feels in general, yeah, it's better more when I'm up moving, or it's better when I'm down sitting. In this particular case, again, the person says, yeah, it's better when I'm walking after a bit, but only for a certain time.
Let me say this, Brad.
Yep.
If you're trying to treat yourself, these questions can help. You may want to go to our program on bobandbrad.com. Go to the program section. We have a free program on sciatica.
Right.
And we don't ask for an email. We don't ask for anything. You can just watch the program. It's got a free PDF you can print out,
Yep.
and it will help you decide what videos you should watch and which exercises you should do.
Right. So you're not wasting time searching
Right.
the internet. There's 40 different videos just on back pain and sciatica. You don't watch them all. You only pick out the titles that pertain to you. May only 2 or 3 of them.
But if you are getting treatment, if you pass this information on to your therapist, it's going to help them.
Sure.
So
Yep.
it's good information to have in
It
your
is.
pocket.
It is very convenient. Now, let's go to the treatment section
Sure.
for this person. First thing we're going to do, because sitting irritates this person, we're going to look at seated posture, which is very often a problem with back pain. And it's very problematic that the person is slouching. They don't have lumbar support, causing the back to round out, irritating symptoms. And it may even feel good to sit down at first, but after you've been there for a while, then the pain creeps up on you. So, Bob, the first thing
So
you do...
if you're in a couch or
Yeah.
recliner, you absolutely want to take a throw pillow and put it in your back, because if you don't, you're going to be rounded out
Yeah,
like this.
right.
If that rounding out makes it worse, that is something you want to avoid, obviously. So you just take a pillow, throw it in the back. I do this all the time. I don't sit on a couch without doing it,
Right.
and it puts me in a good posture.
Right. And it may even be lower than that.
Right.
Down, and the size of the throw pillow makes a difference. You'll
Right.
figure it out. It should feel like good support. Now, some people, it feels okay when they're sitting there, but when they get up, it really hurts to straighten up, and there's a good chance that's from poor lumbar support.
Right. And, if you're in your car, you may want to use a rolled up towel.
Yep.
Or maybe use a lumbar support that you purchase.
Sure.
So
Towel's a good one to start out with because you don't need to buy anything in. They can work good. I've used a coat, and I've rolled up a coat.
sure, I've
and
done the
put it in
same.
my bag,
I've done them in
my car.
movie theaters.
Yeah.
I've taken my coat and rolled it up.
Not your wife's coat.
No,
Good.
she won't let me get
All
away.
right. The next one, avoid movements that irritate the back pain as much as possible. In other words, if you find that every time you bend forward it hurts, well, you need to start doing this to pick
Bend
up
correctly.
Yeah, bend correctly. Your back is going to tell you when it's irritating. No pain, no gain is not what you want with back
Right.
problems.
You want to find the triggers.
Yep.
What's sending it off, and you want to avoid those triggers. It does no good to keep testing your back.
Right.
Does that hurt? Yes, it does.
Yeah.
Does that hurt? Yes, it does.
Right.
I mean, it's just going to make it worse.
So if this hurts and you find out that going this way feels a little bit better, especially if you don't go too far, and then as you do more, it even feels better, then you're going to start doing motions that feel better. Lumbar support, some stretching this way. I'm not going to get into all the details. Again, if you go to our website and you go to the back pain section, it's very clear.
Sometimes just tightening up your abdomen
Yeah.
can make a big difference.
Yeah.
Let's say you have pain when you roll out of bed.
Yep.
try tightening your abdomen first and then roll out of bed, and quite often that will decrease the pain.
Sure. And go back to walking. If you walk and you tighten up your stomach a little bit and your core, all of a sudden you can start walking farther with less pain. So that's another little tip. Oh, Bob, did you want to, let's take this pillow.
Sure.
One thing that works for a lot of people is to lie down to relieve pain is typically you need more than one pillow like this, but even
Right.
this may take the pain away versus this.
And even lying on your side, if you lie on your side, if you don't have a pillow in, it's kind of twisting your back.
Yep.
So putting a pillow between your legs can make a difference like that
Yep.
too.
Yeah. Make a big difference. When you get good sleep, things are going to
Right,
heal better
right.
rapidly, much better than if you're not sleeping.
Exactly.
Yeah. And again, a walking program. Now, if walking
Oh yes, absolutely.
helps, like in this person, they could walk after 100 feet, but after 5 blocks, you're going to walk on the flat, not on uneven surfaces or up or down a hill, and go as far as you feel comfortable. Don't push it, and you'll find day to day that walking distance will likely improve as your back improves, and it kind of works together.
Yeah, and you should do it multiple times a day.
Right, yeah.
Stuart McGill, a PhD out of Canada,
Right.
big researcher into this area of back pain, has studied it for 30, 40 years.
Right.
And he would recommend walking 4 times a day for at least 10 to 15 minutes. So
Right.
very important.
Yeah, whatever your back tolerates. When you start out, it may be only a few minutes, but you're going to progress as you get better.
It's honestly the first thing I would recommend if you can tolerate
Sure.
is walking. That can make a big difference in getting some blood flow to the area and helping your back heal.
Right.
So it's nature's balm, remember?
Yeah, balm. I didn't like that word.
Yeah,
Balm.
okay.
I like it. I don't know.
Soothing.
Yeah, soothing. Anyways, the 5 critical questions. That's what you need to
Again,
ask.
it can help you no matter who treats your back, if
Right.
it's just you or if you have a
Right.
doctor. They're going to ask you these things, and you should know the answers.
Right. Yep. So again, the questions, and we gave you the treatment to follow up on them. Hopefully, this helps. Good luck with that back.
Auf Wiedersehen.
No, really.
You're German.
Well, I know, but I don't even know what that means for sure.
Until we see
Don't
you
worry.
again, I don't know.
Cut.